Hi, this is anchor Shivani Gupta. I'm here at the most prestigious event of India, Anicon 2022 in the city of Joy, Kolkata. And here I have with me.
Dr. Ramesh Bhattacharya. I am neurologist, consultant neurologist for more than 10 years. I am, yes. Next.
Right, sir. Yes, sir. Yes, sir. Here we at IPCA, we are, bringing a revolution over winning over epilepsy. So, sir, I would like to know how far do you think that India is still, too much not familiar about epilepsy?
The thing is that awareness among the persons who are suffering from this sort of disorders is not that much. So, in this aspect, I think media is lagging behind. Both the print media and also the audio visual things they are lacking. So what they need, that at least 1 week or 2 week interval, they should show that there are some disorders like epilepsy, which is more common in our part. When you are suspecting that sort of abnormal movement or recurrent loss of consciousness, you should go to the doctor and take your diagnosis and take the treatment whatever he is offering.
Right, sir. So, sir, how far do you think? What is the major, treatment gap in India, and how rooted this problem is?
Obviously, the treatment gap is one, the knowledge that it can be treatable. So I have to go to the doctors or go to the hospital or health center. This is one. And another thing is that perception that patient can buy medicines, and there are cheap medicines which are available. There are costly medicine, they are also available. But if physician knows that this patient cannot buy the costly medications, he should prescribe at least simple medicines which patient can able to continue. So this is the first importance, and second importance is that a patient should adhere to the follow-up, and regular interval he should come to the patient, doctors and take the medicines.
Right, sir. And what is the most common type of epilepsy which you treat amongst the adults and and the children's?
Among children and among elderly populations, it is the partial seizures which are more important, but definitely some of the children suffer from generalized seizure also. So taking the decision that the patient is suffering from partial or generalized is very easy. What is important that patient should note when the starting of the epilepsy, what is happening to him or her. And at that point of time, fortunately, India is having, every person is having mobile. So they should take their video of their son and daughter, and at the time of epilepsy attack, and he should show it to the doctor that my attack is in that point. But obviously, slightly difference is treatment in focal epilepsy and generalized epilepsy, but that not much difference. You have to take the treatment.
So, sir, the person who are suffering from epilepsy from a very long time, or they have just started, getting into this illness, can they lead a normal life?
Yes, definitely. Because if you see that it is the episodic attack, it is not that it will occur regularly in every day. It is occurring in certain time, and if you take the medication, most of the time it can be controlled. If there are some few attack, that attack persists for 3 to 4 minutes, it will not damage or impair the cognitive functions or mental function. And if you see that there are lot of people who suffered from epilepsy in the past, but they have done their job, like that of Charles Dickens, Julius Caesar, and also John T. Rhodes, who is a famous player. So it will not impair anyone about their cognitive function. If he take medicines and his seizure is controlled, he can lead a normal life.
Right, sir. So one last message for all the people who are suffering with epilepsy. One message for all of them.
You should pick up your disorders. You take the medicines And don't think that allopathic medicines what we are using don't think that it is fruitless, and don't think that it cannot be treatable. It should be treatable.
It is treatable, right, as rightly said by the sir. So thank you so much, sir, for joining IPCA, winning over epilepsy. And I hope this goes to loads and loads of patients who are watching this, who are going to watch this. And I hope this is going to help a lot of them. Thank you so much. Thank you so much, sir, for joining us.